We now take you to Public Protector Advocate Busisiwe Mkhwebane, who will this morning visit the Jubilee Hospital in Hamanskraal as part of the Public Protector's inspection of hospitals reserved, upgraded or capacitated specifically for the treatment of COVID-19 patients. We're joined live now by our reporter Tumaole Mohlaoli. Tumaole, a very good morning to you. A few weeks ago we heard the Eastern Cape, we heard the Deputy Public Protector going to the Eastern Cape and describing the condition of hospitals there as depressing. As the Public Protector is visiting the Jubilee District Hospital this morning, what exactly is she hoping to assess and perhaps level down?
A very good morning to you. Yes, what we do know is that the Public Protector's visit will be mainly to assess the state of operational readiness and functionality of this particular hospital here. What you will be looking for is basically how the hospital's staff are being catered to in terms of protective equipment and also in terms of how the processes here have been carried out to make sure that they are adhering to the very, very strict COVID-19 protocols that have been put into place in terms of the public hospitals right across the country. Now, the hospital has in the past also been raising concerns about the issue of whether the staff here at the particular facility have been provided adequately with protective equipment, as they are right in the front lines of the fight against COVID-19. Now, I can tell you that when we arrived here on scene just a few moments ago, we were screened very vigorously. We were taken through a process of screening whereby our temperature was checked. And to my left, there's a tent. I will just move to my left now as I introduce my guest, who is the acting CEO, which is Mr. Mashudu Madaba. Mr. Madaba, can you just let us know, in terms of the Public Protector's visit to the facility, what do you know about it and what are you expecting to tell her?
Good morning. Yes, we were informed about the Public Protector's visit. She's coming to check if we are compliant to the coronavirus or COVID-19 regulations. So, yes, we're ready. Our readiness is that we continue doing what we're doing all the time since the COVID started. So, we are ready for the assessment. I think it will help us going forward.
When you talk about helping you going forward, we know that there have been some concerns raised, hence why the Public Protector is coming here, about the provisions of personal protective equipment for staff members who are on the front line treating patients during this very difficult time. How is that situation going about, and do you have enough material to supply to your healthcare workers?
As far as PPE is concerned, we honestly never had problems. Our stores has never ran short of PPE. So I'm not sure if there are problems. It could be that people were not wearing appropriate at a particular area. But as far as PPE is concerned, we always never ran short. We always had enough stock from our stores.
And if you can just give us an update while we're at it, in terms of the situation. We know that Gauteng province certainly is one of the provinces that are still to hit the peak in terms of infections, if already we are not there. What is the situation in terms of what you're seeing with patients coming in and recoveries?
There has been a spike. We can say that as a hospital, our infection started very late, like late June, beginning of July. I think July is where we had a lot of people testing positive, including staff and patients. But for now, that has seemed to go down. So, yes, we've been dealing with case per case. Like we started with screening all the patients when COVID started. And then those who were seen to have got symptoms were tested. And then after testing, we came to a situation of admitting the PUIs. And then those who test positive will then be referred to to the cluster, which is George Mukhari. Yeah, that's what we've been doing very well.
And finally, just very quickly, one last question is, where do we stand in terms of the issues of beds? We know that it has been a critical shortage of beds for people who need to be admitted when they are displaying very critical and very serious symptoms related to COVID-19. How is the hospital managing, and what is the situation?
What happened, of course, this has been new to all of us. We didn't have COVID facilities. So what happened is that once we saw that we were receiving a lot of PUIs, we started creating space for them. After screening those who were sick, who needed admission, then we created space for them. We have so far converted 3 wards, which was our Ward 1, our ICU, and our step down. All those 3 wards were converted into PUI. So those who were positive, now they are admitted in what we used to have our ICU. So yes, the numbers have been rising like I indicated in the last month. And then we converted ICU into admitting those who were who tested positive. Our hospital is not necessarily meant for treating those who are COVID positive. We treat them in transit to George Mukhari or to referral to hospitals that are designated for COVID. So we've been, while they are waiting or while we are in the process of referral, sometimes it takes time. That's when we decided to have a ward for those who are in transit. So far, like I indicated, we've got 3 wards already converted. And going forward, we've got a tent that has been also built, and then we're awaiting toilets. And then in a long run, there is a new hospital, 300 beds, that is being built to accommodate the COVID patients going forward.
Mr. Madaba, we're going to have to leave it there. Thank you very, very much. That was Mr. Mashudu Madaba, who is the acting CEO here at the Jubilee Hospital, just giving us an overall view in terms of the latest updates in terms of figures, and just basically reiterating what the Health Minister and, of course, the Provincial Department of Health have been warning, that Gauteng is now set to experience the peak of the COVID-19 infections. But as we have just heard, of course, this particular facility, the Jubilee Hospital, has been on top of the ball and trying to make sure that it attends to all those who need help during this very difficult time. But that is back to you in the studio.